Everyone can hear me, listen me?
Yes.
Okay. Um, okay. Good morning, everyone. Thank you for attending attending today. For those who haven't meet me yet, my name is Bruna Bertogattiboni. I am a medical student and a master's student from Brazil. Today, I intended to give a brief presentation on an article focus on an interesting analysis of geospatial data. Okay, I am a little nervous, but okay. I uh, I would also like to mention that I'm not I have my script because I need help, okay, and I put here because I need okay uh uh okay
You're going to do
uh
great, Bruna. So go for it. If you need some help at some point, it's totally fine.
okay, thank you. Okay, I would also like to mention that I'm not an expert on this subject. I was recently introduced in the world of data analysis, but general data analysis and geospatial analysis have caught my attention because I realized that this is are important tools that I can apply in my profession in the research and medicine. No, for to save the moment, the time, I strongly recommend using the automatic subtitles so that you can better enjoy the presentation. Okay, because it's my first time. Okay. The articles is title, title is made of the numbers and distributions of zero dose and under-immunized children across remote, rural, urban, and conflict affect settings in low and middle income countries. Okay. Uh, the contextualization. The article address some important topics such as challenge in immunization is expansion. Despite a global increase in the vaccine coverage, routine immunization is special. The first dose of diphtheria, tetanus, tetanus pertussis vaccine, and the first dose of the males containing vaccine. Okay, this is a, routine vaccines. Okay, these routine vaccines in low and middle income countries face challenge due to limited access to healthcare because poverty and civil conflicts, these vaccinations converge, which was already declining in 20, uh, 2019 and had a great impact during the pandemic in 2020 the intervention in the healthcare service. Okay, um, the other challenge is the other topic is initiatives to prioritize immunization. The Vaccines Alliance. Um, the impact of the pandemic of vaccination coverage make the it's necessary make the initiatives to prioritize immunization. The Vaccines Alliance adopted a new 5 years strategy for 2021 and at 2025 with the vision of leaving no one behind in immunization, increasing equitable, equitable and sustainable vaccines utilization. Additionally, the World Health Organization's immunization agenda 2013 established a global vision and strategy for vaccines and immunization, committing to a combinations goal of reducing the number of children receive zero doses by 50% by 2030. Okay, but have these initiatives to prioritize immunization have give a difficult. Okay, I repeat this. I said the other. Okay, but when these initiatives to prioritize immunization want to make the work with the vaccines have a limit a challenge because and the challenge is for with the estimate unvaccinated children. Uh, However, this initiative face a problem because to leave no one behind, they first need to know who many children they need to vaccine. Currently, there is still a significant limitation in estimated unvaccinated children, particularly particularly in remote rural areas and disadvantaged urban areas and conflict zones, make effective resource allocations and strategic conceptions a challenge. Um, and um, and this is a big problem because when you have the children easy contact is okay, you know the child, you can offer the vaccines, but when you have this situation, the image is a challenge, make the immunization. And for this paper, this article have for me is in innovation and have interest in innovation in the some topics. So far, there had not been a global scale analysis in this more refined spatial resolution focused on the number of unvaccinated children during the pandemic. The reals of global geospatial data and accelerate the particular specific rural locations and enables a more detailed analysis today. The geographic data essential is one of the major advances invested by countries aimed at providing information for action. By doing so, it enables the resolutions of public health problems in less time and the lower cost. This data analysis is important to achieve the sustainable and development goals, whose motto is leave no one behind. These articles focus on vaccines, but also analyzes other topics such the mortality, maternal mortality, tuberculosis, HIV, cancer, violence preventions, water quality, among others. Okay, and for me, and this article have is interesting, is interesting the bringing knowledge in the original language. When you know what is the local geospatial local, and the people need help, uh, help care help, um, uh, we can give the assistance in the original language, because sometimes the articles, knowledge is in English, but these articles don't arrive in the necessary place. And when you know what is the place, what is the language, you can make the a good work and with the peoples, because you can make the peoples understand what do you need, make together the persons. Okay, I don't know how I say this, but it's okay. And whatever. Now I will attending. I I thought about the data and methods. The articles make the stage. First, mapping of children under 1 years old. Um, After mapping unvaccinated uh, on children under 1 year. For these vaccines, DTP1 is when the child give only one vaccine, the DTP. DTP3 is the child give the take all the schema de vacinação. I don't know, but the three
Vaccination scheme.
vaccination scheme. Okay, and the MCV one vaccination, and after now the under under 1 years old and unvaccination, the mapping the urban and peri-urban areas, remote rural areas, and rural and conflict affect areas. Okay, in this mapping in the population, um, first, the population estimate for children under 1 years old were deriving from the 28 2019 World Pop data set at 141 kilometers. Grid square solution. These estimates were the aggregate to administrative border boundaries, and the second substantial level using the global administrative areas database. The methods employed for estimate this population involving machine learning techniques along with various geospatial covariates to disaggregate populations comes from larger areas onto to the 141 kilometers with squares. Additionally, models based on census, survey, and microdata are used to further disaggregate this estimate by age and sex. Okay, this map in specific not don't happen in the articles. I take this map for one example, the population density map, this map is by Silvana because and the articles don't have one population density map. The child only the child's but have the other maps. I let show you after. Okay. For the mapping on unvaccinated the under one child's under 1 years, uh, for these vaccines were obtained from the Institute for Health Metrics and Evolutions for 2090, and a resolution of 545 kilometers. But the vaccination converged the data set where the result resembled resembled to a resolution of 1 kilometer to match the world pop estimated uh, the child under 1 year, and with the square were subsequently calculate the unvaccinated multiplied by the child before summarized by these that are using this data analysis. Okay, this is an example. The map. Um, this is an example. The map for the DTP1, and in this case is only the child's mapping the child don't under vaccination DTP1. Okay, and after make the mapping on vaccination, um, the child under 1 year in urban and peri-urban areas. In this case, the challenge is, and the data set is for the 545 kilometers. But when you talk about the urbans and peri-urban areas, uh, 545 kilometers is bigger the square in the square in the cities, and you need more precision and make in this case and the data analysis change for 1 kilometers for more precision, but the uh, in urban case have a problem because you can make super estimations the under vaccinated child, because it's very difficult. You have a precision quantity the child's under unvaccinated or subvaccinated. Okay, this is an example. The
Hey,
map.
Bruna,
Oh,
can I ask you a question? What
okay.
is what is on the figure on the right?
The right. This is in the
Yeah.
purple.
Yes.
Okay, this is in the what? Ai, meu Deus, travei aqui. So one moment. I
Oh,
need
I see there's a caption in the bottom. So the figure to the left is the map highlighting the geographical setting
yes,
with
and
the
this other
estimated
map
greatest number of
is for
children
the
in everyone.
vaccines. Is in the vaccines, and the left and the color, the rainbow, is a urban is the locals, and the purple is the the child's under vaccinate in the for the vaccine, and have I don't know say this in English. but in oh my god, I
Yeah, no,
well,
I get it. I get it. I get it. Yeah. So
okay. Sorry, I was sorry,
no, you're
but
fine. You're fine.
uh, I will
I think the
continue.
figure on the left is stratified by urban and the right is not stratified.
I don't know. It's for me.
Sorry, Timothy, your audio
Okay, okay.
is very low.
Yeah, I say I think the figure on the left is stratified by urban and rural. The right
Yeah,
is
no,
not stratified.
it is, but it's for some reason there's some information in the map to the left that I'm not capturing. So estimated greatest number of children under 1 year of age in 2019 not receiving. So I don't understand what that is, because the map is just a choropath map, right? So it's just showing every geographical area has a color
For ex
based on their for what
for
the
ex
geographical area is. So I don't know what it's highlighting. Sorry, Silvana, go ahead.
but for example, the map the population is free, is the open source. In this
Right.
map, in the workbook, is for group age, and estimates on the national Unidas, United Nations, and denominator is established. But compare imagine the satellite with the population
Eu não
de
consigo.
Naciones Unidas and combine and denominator, and numerator is at the doses apply of child. Data is open source in the all the countries and the World Wide Web and the open source. For example, datos abiertos .gov.co in Colombia, for
Sure.
example, and the response and the subnational distribution and the doses. And the
Yeah.
difference in populations denominator and numerator is established and no vaccines, and the coverage the vaccination, for example, in minior 95%, for example.
Yeah. No, so I get that. What I'm not understanding is what is mapped to the left representing. If it's just showing the areas, I'm assuming it's just showing the classification of the areas in urban, peri-urban, rural, but I don't understand why the caption says anything around 1 year of age, not receiving
The area
DPT1.
is vaccine and the child under 1 years, and the number of child in the under 1 years, and the cape the map is determination an urban, peri-urban, rural, and conflict, and the color is the child under 1 years en 2019. But distribution is the descriptive analysis and spatial analysis of the most of people, and they send the areas is very conflict, but with child. Es decir, lo voy a decir en español para que lo ayudes, alguien me lo ayude a traducir. Representa las áreas urbanas, periurbanas, rurales y en conflicto, donde existen niños susceptibles a vacunación. Es un análisis
Okay.
descriptivo
Okay.
para mostrar ese análisis.
Okay. Yeah. No, I hear you. Okay. Okay. So map on the right is representing the areas that have children. And that for me is a little weird, because I'm assuming every area has its children if there's population, right? So that's why I was having a hard time understanding what it is. So the caption I think is just a little misleading. But yeah, so the map to the left are just a classification of the urban characteristic of an area. And the map to the right is the actual estimation of vaccination. And what I find interesting here is that they're estimating vaccination and they're attributing vaccination to smaller density areas. Sorry. And that's what I'm interested in. So the fact that they are able to further specify geographical locations and then attribute population and estimate coverage to those smaller areas is something I'm very interested in. So thank you, Bruna. Yeah, keep going.
Okay. And I understand your question. Now I understand. Now I understand. Yes, in the but I will need okay. I don't explain because this is a new thing for me, but I thought is because I comment about the urban areas you can more superestimate it. You superestimate the under vaccinate child. And this is a is a problem for the for you can for data analysis because you need and not only but this is a problem and the vaccinate uh, the vaccinate in the other countries have a challenge in the vaccinate and in urban place too. Don't not only in the rural place and in the remote place, but is different is a good question because okay. But um, if I come back, okay. Oh my God, I can't. Oh yes, and maybe mapping unvaccinated child under 1 year in remote rural areas. This is despite being despite being by being a population grow likely to be one or under vaccinated, estimated the proportions of unvaccinated children in urban slums in challenges due to limited global data of their locations. Additionally, the spatial resolution of immunization converse estimate from IH in E, yes, produced at a 545 km scale may overestimate the numbers of unvaccinated children in urban slums. Therefore, estimates of unvaccinated child under 1 year in urban slums were not included in this analysis. I, and this is an example of the map. And okay, this is the mapping in the rural, no remote areas. But here only I take the some place because I don't find in the map the global map in this article, but the number of unvaccinated children under 1 year of years in remote rural areas was estimated using travel time estimate to define remote areas and the global human settlement layers to define rural areas. Remote areas were classified as just with a travel time of one oh my god, 180 minutos, or this time or more to the nearest city, while rural areas were identified using G GHS as mod classifications. The data were harmonized and resampled to match world pop data before estimating the number of unvaccinated under 1 year, and the grid square levels summarized and at the HDM2 levels using the GADM administrative boundaries. Okay, and this is an example, and this is mapping the conflict affect areas. Again, I take this example because I don't find the global global map, and reminding children under 1 year not classified as urban, peri-urban, or remote or rural were considered rural, no remote. Ways methodology was used to estimate the number of unvaccinated in these areas using travel time categories and the similar types, but near series were categories into intervals 0 to 60 or and these times the data were harmonized and resampled to what word pop data before estimate the numbers of unvaccinated at the grid square levels. For more the details in the maps, and this is an example. In this map for me is very interesting in the because you can know the conflict areas, and sometimes don't have is inter countries, and you need and sometimes is in the is in inter countries, and you know what the population is more affected for the conflicts and don't have the vaccines. And I like this map. Okay, and okay, thank you. Muito obrigada. Muchas gracias. Finish. Não moving? Ah, não move nada?
Termina de...
Ok. A ver, deixa eu ver como que eu faço. Retomar compartilhamento?
Eu acho que a tua tela ficou parada no slide lá.
Meu Deus, ok, ok. And okay, I
Não, tá tudo
will
bem.
show you
Ele
the
parou no,
what.
ele parou ali nessa daí, no 9, isso.
Okay,
Vai pro
okay.
próximo.
No problem. Oh, no problem. I will show you the maps because I talking. Okay, but the maps. This is the other maps in the remote rural areas, and the things. Okay, and this case, the scales in the data analysis is 5 for 5 in scales, and change for 1 for 1 kilometers, and make this map. This is a sample, and this is the rural no remote areas, and this case is the I only take the this place because don't have the global map. Okay, and in this case, the rural, non-remote areas, they were classified as choose with a travel time of 180 minutes and more to the nearest city. Okay, and this other map is the conflict affect areas, and is similar. The for the conflict areas is more, the time is more precise, uh, because were categories into intervals of 0 to 16, or 16 and 1 to 0 times, and the conflict areas, is, I mentioned before, I like this map because you can know what is the specific populations and the with the conflict, and sometimes is in different countries. And okay, thank you, muito obrigada, muchas gracias. Is this okay? Have questions, please? I don't know, because this presentation is como que eu deixo de compartilhar? Meu Deus. One moment, okay. This article is for me, this presentation is for make make the interesting about the geospatial data analysis, because is very interesting. When you look, you look, oh my god, it's very hard work make this map, but is necessary the analysis, and it is.
Oh, thank you, Bruna. I didn't know about this paper, and I think it's a very important one. So to give you an example, and to others in the room to contextualize why this is important. So in one of the projects we're working on now, we are trying to combine data that are at different geographical resolutions. And so when you talk about geographical resolution, like Bruna was saying, 1 by 1, 5 by 5, it's kind of like a pixel resolution. When you have an image and you have large pixels, you have a very blurred image because you don't have a lot of small detail of color, and then you have less capacity to see the image. When you have a very tiny resolution, then you have a lot of small little colors, you can see higher quality images, right? So now imagine I'm looking at a map, and when I look at a map and I look at country distribution, I have a very low resolution area because I have very high areas with information of data. So if I plot population by country, I'm gonna have a lot of less information on where people are distributed than if I plot municipalities. But even municipalities are not good resolution enough because they're very wide, and people distribute themselves differently across the geographical areas of municipalities. So what we do in geographical analysis to try to condense even further is to build small geographical units that are this grid, which is basically you get the area you're working on. So let's take a municipality area, and then you separate that municipality area with a grid, kind of if you're putting another layer on top of the map that have very small squares. And these small squares could be 5 by 5 kilometers, or they could be 1 by 1. And so the smaller the unit, the better visualization you have on that particular phenomenon, right? So if I'm looking at climate, or I'm looking at weather, or I'm looking at rains, if I have the data for a small unit, then I can identify if I'm going to have a larger water accumulation in a particular area of the city versus another area of the city. And that's how we predict weather, for instance. So the same concept can be used for diseases, and that's what Bruna is presenting. So there is a very important group called World Pop. That is the group that bases what Bruna is presenting, that builds predicted databases that combine the population estimation coming from household surveys or census with satellite imagery to help us further distribute population from a municipality level or a census tract level from the census survey to small units of 1 by 1 kilometers of grid. And they do that because the household surveys are going to tell you that you have an average of 2 to 3 people living within a specific household. Then what they do is they predict the number of people that would live in each of these small squares based on the amount of buildings they can see on a satellite imagery on that particular area. And with that, they are able to redistribute the population. So if I have 100 people living in an area, but then I have half of this area is forest, the other half is buildings, then I have 100 people living in half of the geographical space and 0 people living in the other part, which is just forest, right? So that allows us to further distribute population into very small geographical units. And then we can get that information to build analysis, like the analysis we're doing on the Saving project that several of you are part of, or that Marcos is doing on the dams project, which is estimating who is the population that is at risk for a given health condition or a disaster, or even just understanding how far people are in accessing care. I know that Gabi is interested on this topic, Nathan is interested on this topic. So very important topics to do that these advances have allowed us to do. But now we're working with snake bites in the Amazon. And snake bites are conditions that we don't know where they happen. All we have is the aggregated number of cases per municipality, or maybe per district, or per census tract. So we want to redistribute the snake bite event so we can have them in the smaller geographical unit. And this paper is doing the same thing for vaccination. It's creating a vaccination index based on the rates of vaccination on the population distributed by the number of people. Maybe we can do similar things for HIV, for violence, for snake bite, for alcohol, if we are able to create a good rationale of how you would redistribute your disease, your condition, based on the population estimation. And that's something that I think is extremely important. So yeah, it's a very good paper, Bruna. I invite everybody who is doing this kind of access to care work to review this paper. And then of course, Bruna is definitely doing this presentation in a language that she doesn't fully master, and she's in process of doing that. So you did very well, Bruna. Thank you for guiding us through a very complicated methodology. That's why I was laughing at you yesterday. It's a very complicated methodology, and you guided us through. So thank you very much.
Thank
Yeah,
you,
definitely
you.
want to talk more about this approach.
Thank you everyone for the patience and thank you so much. And the other time when I this paper is I don't know I say this, but I hope this when oh my god where eu vou falar em português porque é mais fácil. Alguém, por favor, traduza, porque eu espero que esse paper, quem ter interesse, sirva como uma porta de entrada para a data análise da parte geoespacial, porque para mim foi e é muito bacana, muito legal.
Yeah, what Bruna is saying is that she hopes that this paper is a good entry to those that are interested on GIS and geographical-based data analysis, because she found it very interesting. Yes, I had a question, and maybe we can use the 10 minutes to discuss that. If Silvana is more familiar with his methodology, or if Marcos has read this paper as well. So the IHME, who provided the data sources for vaccination, had the vaccination on a 5x5 radius, and I think I don't know how they got to that distribution, if that's based on household surveys, that they did a similar work like the World FOP did, and just redistributed that based on households, or predicted that globally based on households. And I think that's an important, it's easier to change a 5x5 than changing a population marker. But the question that I had is, in our snake bite case, for instance, or on the HIV case, which we know that there are particular groups or environments that are more susceptible for the disease to exist, can we somehow use environmental data to predict the occurrence and then redistribute that based on this prediction?
It's possible because
should we-
the environmental like free many data. For me,
Yeah,
for example, the acoustic data, the mobility data, and the station, the methodologic is open source. All the data is open, and remote sensors for
yeah,
pollution, and for example, the structure, populational, and the most important is the satellites is free now. The pandemic is open, the distribution and images, and the NASA is open the 1 month and distribution other imaging satellites, and the quadriculas some very cheap. Is very
yeah,
important for analysis for dengue, air
right.
pollutions, cancer, other things.
Yeah, but so, yeah, yeah, I would like to talk more about this, because I know that all the dengue and malaria forecasts, they take into account the presence of the mosquito. And so it's kind of easier to predict, because if you have the mosquito and you assume the mosquito is biting X people in their life cycle, then you can estimate what's your proportion of cases you're going to see. Because it's easier, right? The mosquito is there, and there's surveillance on the mosquito in most places. Uh, yeah, yeah, I think we need to talk more about this. Yeah, very interesting.